Great. Well, thank you for coming to visit our program. My name is Lindsay Kim. I'm one of the chief residents from UT Southwestern. So here's a quick history and overview of our program. So we were established in 1977, and we've had our ACGME accreditation since 78. We're one of the larger PM&R residency programs with 9 categorical spots per class. And some of the highlights of our program include a very broad exposure to PM&R. We have faculty who are trained in a lot of different subsets of PM&R, such as sports, spine, burns, peds, cancer. So you'll get a lot of diverse exposures to different facets of PM&R. A friendly learning environment. We all like each other. We're all good friends. Diverse patient population. Here in Dallas, we have a pretty diverse uh, posh populations. That was redundant, but like lots of different patients will come, especially since we're training at Parkland, which is a county hospital. And then we pride ourselves on being a very hands-on residency program where it's very autonomous. You're going to get a lot of reps on your own. It's not just going to be you following around and attending. You're going to be doing things and making decisions on your own. All right. And then to introduce kind of the people who will be involved in your residency experience. So from the top, we have Dr. Kim. She is our lovely department chair. She's very passionate about teaching us and taking good care of us. Our program director's name is Dr. Scott. I think this is her 3rd year as program director. We also have Terry Isbell, our program coordinator. And then our associate program directors are Dr. Kasidanan, Dr. Sharma, and Dr. Kumar. And then in addition to me being one of the chief residents, we also have my co-chiefs Imran and Casey, and the 3 of us kind of help take care of all things that the chiefs take care of and advocate for all of our co-residents. All right, so if nobody's been to Dallas, Dallas is like a pretty big city. I'm from Seattle, and Dallas is just so huge and so spread out. I guess the population surpassed 8 million in 2023. It's one of the fastest growing metro areas in the US, the 8th most diverse city in the USA, and the 3rd busiest airport in the world. If nobody's been to DFW, there's like a train that connects you to the different terminals of the airport, and it literally takes 20 minutes to get from one side to the other, if that gives you like a context for just how big that airport is. So it's a very big city. And then in terms of UT Southwestern specifically, it is the largest medical school in Texas. We have the 5th largest ACGME program per the number of residents and fellows nationally. Our medical school is ranked in the top 25 nationally, and we have a strong research productivity at UT Southwestern, being a top 3 global healthcare institution ranking by Nature Index. Um, and so I wanted to kind of go over like the different rotations that you'll have between your intern year, your 2nd year, your 3rd year, and your 4th year, just to kind of give you an idea of what kind of exposure and experience you're going to get. Um, as a caveat, right now there are 6 categorical and 3 advanced spots, but that will change starting with y'all's intern year next year in 2026. We're transitioning to having 9 categorical spots. So as a result, some of the things that are accurate for how everyone's experience is right now will be a little bit different by the time everybody gets here. So the current intern schedule, we changed this year based on feedback from everybody on the experience that they were getting and what they thought was going to be most helpful for preparing them for inpatient rehab. So during your intern year, you get a smattering of different things that we think are going to best prepare you for your inpatient rehab experience. So we do a lot of internal medicine wards and internal medicine consults, just that way you have a good foundation. We do emergency medicine, so that way you can learn acute management, how to triage patients. Neurology, we do a lot of neurology, so we spend a lot of time on the general neurology service, so we can see things like seizures, the stroke service. They'll be in different outpatient clinics, which is new as of this year. And then you'll also spend time with the resident who's on call to take calls from the emergency room. So you'll see myasthenia crisis, seizures, strokes, all in the very acute setting. And then in addition to all of that neurology, you also spend time with neurocritical care. We have a specified neuro ICU that is mainly neurosurgery patients or people who are on like Cranny Watch. You also get time in burn surgery. We have a burn ICU, one of the biggest burn centers in the area, and you'll get good hands-on experience in taking care of acute burns, which is good for preparing you for when you're in burn clinic as an outpatient, as a 2nd, 3rd, and 4th year. We rotate with MSK radiology, and then as of the last 2 years, we've been transitioning to get the interns more exposure to PM&R, both in our inpatient and outpatient clinics. And then here's kind of like a big picture overview of second, third, and fourth year. The main things that I wanted to highlight is we're hitting all of the different subspecialties. We're getting time on SCI inpatient, SCI outpatient. We get a lot of brain injury. We're doing a lot of consults. We're getting time on peds. We're getting general inpatient rehab, medically complex services, and then kind of more towards your third and fourth, you're doing more outpatient specialty things. And then things that we've changed in the last couple of years based on our feedback is getting more time for selectives. So as you can see, your third year, as of this year, you're getting 3 weeks of selective where you can choose whichever clinics you want to go to, and that's a way for you to get early exposure to things to decide if you want a fellowship, which kind of fellowship you would want, and be able to get good exposure to that prior to having to apply. And then your fourth year, you'll get 6 weeks of selective. And then we highlighted this just so that way everybody can see it. Your fourth year, you have no call and no weekends. We front load all of our call and night flows second and third year. So that way your fourth year, you're only working Monday through Friday, essentially 8 to 5, which has been really nice. Um, and then as far as our curriculum and didactics, we have a 12-month curriculum, meaning that you're going to get every single topic in every lecture once a year, so 4 times. We're also having our interns join our didactics more this year. In the years past, because they were rotating with other specialties, they didn't always get the chance to come, and now they are. We get protected time every Tuesday, meaning that your attendings are going to be covering your pager and taking care of things on the floor, so that way you can actually be focused in lecture and not have to worry about taking care of other things. And that also includes them writing your progress notes for the most part. And then our curriculum is kind of structured in a way where in July we kind of have an intro and advanced series where there's kind of like basic things for the new incoming PGY2s, and then different lectures for the PGY3s, just so that way if you don't need that topic again, you're learning something else. An example of the something else would be this most recent year we had legal counsel come in and talk to us about like what it's like to be deposed, or what it's like to get subpoenaed or something like that. And then we also had panels where people discussed their experience being in private practice versus academics, and then another panel for fellowships. So it's nice to kind of get a smattering of other lectures besides just hardcore like board review topics. In addition to all those lectures, we also have a lot of workshops, including ultrasound curriculum. So I think last year we had 6 different ultrasound workshops. This year we're looking to have 6 to 7. And those workshops include time in our sim center with cadavers. So you can practice doing ultrasound guided procedures on the cadavers, which is really nice because you can practice as many times as you want, and you're obviously not going to hurt anyone. And then we also have monthly grand rounds. We have journal club a couple times a year. And then we also get free breakfast every Tuesday, which is something everyone really enjoys. Some of our favorite hits include Chick-fil-A and breakfast tacos, which Dallas is known for. And then here we have some pictures. This is from Spasticity Day with Dr. Gould going over phenol injections, Dr. Kim going over Botox injections, and then some of our PGY2s practicing EMG. As I said before, we pride ourselves in being a very hands-on program. So these are pictures from some of our sim center days where we are practicing in small groups how to ultrasound different joints of the body, and then practicing how to do different injections. As I said before, we're like a very autonomous program, so we get a lot of reps doing things ourselves, and that includes things like procedures. We do a lot of different procedures like the ones I've included in bullet points over here, but the main thing I wanted to go over is this is a snapshot of my personal ACGME total of procedures that I've done. So I just started fourth year, July. It's August now, and as you can see, I only need 20 EMGs to graduate, and I should be able to get that in 1 week, and I have 6 weeks of EMG left. So you can feel very confident that you're going to be prepared to go out into the real world having done a lot of procedures. And then even on the rest of them, you can see that I have at least 4 times the number that you need to graduate. And so I just want to emphasize to you guys, if doing procedures is something that's important to you, going to a program where you're able to get a lot of hands-on experience is very important, and you would certainly get that here. Everyone's favorite topic, the call schedule. So we have a in-house 24-hour call where you're covering 2 different hospitals, Parkland and Zale. And as I said before, we front load our calls. So you're doing this all during your PGY2 and PGY3 year. And so because we're a larger program, it means you divvy up the number of call days amongst more people. therefore fewer calls. So for 24-hour call, you end up taking around 6 to 7 calls during your second year, around 6 calls during your third year. And then in addition to that, for the VA, they don't have 24-hour in-house call, they just have home call, meaning that you have your pager on, and if they need something in the middle of the night, they'll page you and you can log in and put in an order for Tylenol or something. And so you do 6 weeks of home call during your second year. And then in addition to the 24-hour call, we have a night float that's Monday through Friday. And you'll do about 3 weeks of night float your second year and about 3 weeks of night float your third year. And then as far as total weekends worked, we also have a resident who will round on Saturdays and Sundays at Parkland and then sign out to the 24-hour call person. So overall, the tally over here I have is you're going to work around 18 or 19 weekends as a PGY2, around 10 as a PGY3, and 0 as a PGY4, which honestly is really good, especially compared to some of like our internal medicine or surgery colleagues only working, less than half of the weekends per year is pretty good. And so this is a picture of all of our faculty. We have a very large faculty with a good mix of younger faculty and more experienced faculty. And then a lot of them have different fellowship training, including brain injury, sports, spine and pain, peds, cancer, spasticity, neuromuscular medicine, and stroke. So you'll have a lot of very educated, very talented people teaching you. And then I've already touched on this a fair amount, but we have a lot of different subspecialties, including all of the ones that I mentioned as far as like the faculty and their training. In addition to that, you also have faculty who are trained in pelvic floor rehab, which is pretty unique. Not a lot of programs offer that. Burns, as I said before, we have a spasticity fellowship. And so we have a lot of people who are very, very highly trained in very specific things in PM&R. And then over here, I included some photos. So in the top left is a picture of me and our associate program director, Dr. Kasidanon. We are doing sports coverage for Dallas Trinity FC. So you get a lot of opportunities to do different sports coverage if sports is something you're interested in. In the top right photo, there's Dr. Kowalski with one of our chief residents, Imran, and then Josh and Joe. They were at Burn Camp where they get to go and do summer camp fun things with kids who have gotten burn injuries. And so that's a really fun experience for them. And then the bottom is in our fluoro suite doing spine injections. And then as far as our training facilities, Parkland Hospital is renowned for being where JFK was taken after he was shot. And so they really kind of emphasize that as being part of its culture. And the other thing Parkland is known for is the Parkland formula over there on the right, top right. I remember learning that in medical school. And then when I matched here, I was like, oh my gosh, that's where the Parkland formula came from. But Parkland is a county hospital, and it's a very special place because we have this program called Parkland Financial Assistance, where it's a charity-based program that provides comprehensive, low-cost, free healthcare for low-income residents. And so it's a really cool opportunity to provide services and care to patients who otherwise wouldn't be able to afford it. And it feels really good to help take care of people who like really need your help. They're very grateful, and it's just like a very nice environment to work in. And then if you see these pictures at the bottom, there's like a circle here. That's our rehab unit. We're on the 17th floor. We like to call it the penthouse. It has a good view of the city up there, and so our patients really love it. One of our other training facilities is Clements University Hospital. It's about a mile up the road. It's the primary teaching hospital for UT Southwestern. It's ranked the #1 hospital in Texas. It's top 20 nationally, and it has 11 specialties ranked in the top 25. PM&R is ranked number 15. There are 750 beds there. Here you would only do a rotation here your fourth year when you're doing PM&R consults, and that's where you're seeing inpatients at CUH and helping to decide which patients are going to go to our Zale inpatient rehab.
Hey, Dr. Kim, I just wanted to give you your 5-minute heads up.
Okay, I'm going to go faster. I'm so sorry. So one of our other main training facilities is Zale Lipsche. That's where you'll do your primary inpatient rehab. We have 2 separate floors with about 48 beds, and we see a lot of brain injury patients, spinal cord patients, and medically complex and transplant patients. And so the top is going to be a photo of Zale in the foreground and then children's in the back. And then on the bottom, there's a picture of our whole rehab team. The therapist threw a party to get to know all of the residents at the beginning of the year. And so we just have a really good camaraderie amongst all of the residents and the faculty and the staff. Another place you'd rotate at is the Dallas VA Medical Center. You'll be there all 3 years, second year, third year, and fourth year. Second and third year will primarily be spinal cord injury. And then, I'm sorry, this is different now. The spinal cord outpatient rotation is now as a PGY2. You'll do EMG here and then an MSK and a TBI rotation. And during the MSK rotation, you get extra ultrasound curriculum with Dr. Merchandani. We also have 2 rotations at Children's. You'll do 6 weeks inpatient and 6 weeks outpatient. And then in addition to that, there's also an adult cerebral palsy clinic that Dr. Kim does at Parkland. And so that's children's facilities. You also do 1 inpatient rehab rotation during your 4th year at Texas Health Presbyterian, which is a private community hospital, and it kind of gives you exposure to other types of inpatient rehab that aren't extremely complex, like at Zale or at Parkland, to kind of prepare you for what other non-academic jobs could be like. And then here's a list of our additional clinic training sites where you can go and rotate if you would like to, just to kind of emphasize that we have a lot of other clinics throughout the area where you can work with different attendings. As far as research goes, we have a burn and TBI model system, and then we have residents every year who are going to present different posters and presentations. And so here are some photos from AAPM&R and AAP, and some of my co-residents with their posters at AAP and AAPM&R. As far as benefits goes, we get free parking at all of our clinical sites. We get a meal stipend. We have an education stipend that you can spend on books, a computer, conferences, whatever you want to use your education stipend for, you can use it. We get a membership stipend to the different PM&R entities. And then Parkland also has a special thing where if you're trying to have a baby and you have all of your prenatal care and deliver at Parkland, your birth is going to be free. So it's nice that they take care of their residents in that way. And then other things that we've been really priding ourselves on is our camaraderie with our annual events. So every year we have a retreat where we get to just go and hang out, and the department pays for us to do a fun activity. We have an adaptive sports expo every year. We have a resident faculty flag football game every year, which is this top photo. We have a resident faculty pickleball game every year. And then we also have scientific day where we celebrate everybody's research accomplishments. And then these are just pictures of like all of us hanging out. So like Dr. Chen is one of our new attendings last year. He was a PGY4 and he stayed on. And this is a cute little twin photo. This is Dr. Kowalski with some of our residents at pickleball. Every Wednesday, a group of people play basketball together, residents, medical students, and attendings. Grace and I like to go to happy hour with Terry. And then this I just think is funny. This is my 2nd-year resident, Emma Kim, and Dr. Kim, and we took a Kim family photo. So we have a lot of fun. We like each other. So sorry I had to speed through the end there. I still want to make sure I go over anybody else's time, but we think we have a really special program, and I really appreciate you guys tuning in to listen to me talk about it. I hope I answered any of your questions. Our contact information is here at the bottom. Please feel free to reach out to me if you need anything, have any questions about the application process or anything about UT Southwestern. I'm happy to help out.
Hey, thank you so much. By the way, congratulations on so many procedures. That's pretty cool.
Thank you. That wasn't a brag. That was a you will get this many too.